Yes, and it's never looks like it's fun for anyone having that experience.
Was it a rotator cuff or was it something else?
Brent, I'm not sure what the original surgery was for. Yeah.
I just had a friend who had a rotator cuff surgery. They did it arthroscopically at Stedman, and that was my first experience. Boy, do they do a job. I mean, they had a whole electronic, cooling thing on her. I mean, I've never seen such attention paid, and really quite something.
Yeah, that I would imagine that that's a good place to be going in this area for.
Yeah, if you have to go.
Yeah.
Yeah, Marky had a shoulder replacement, so having a
Replacement.
dislocation on a replacement is a bit of a problem. But anyway, I'm here to sit in for her.
Good, nice to see you.
Yeah. And then Greg, who was our vice chair, which would normally he would be leading the meeting, was traveling. I'm not sure entirely where, and he wasn't sure if he was going to have really consistent Wi-Fi. So I will be leading the meeting, just to let you know. I'll be the facilitator of the meeting, as well as one of the presenters today. So
okay.
It looks like we have quorum right now, from what I can tell, with Bill filling in for Marky. We have Linda, Brent, and I saw Tori, although, oh, there you are. So yeah, okay, great. And there's Tori. So we do have quorum right now. And it's 1:31, so I wanted to go ahead and get us started with the agenda, going through that, and then talking through the various different presentations that we'll be having today, and opportunities for discussion. So Lindsay, would you be able to go ahead and pull up the agenda?
Can we just get a motion to start the meeting?
Sure. Can I have a motion to start the meeting?
I motion to start the meeting.
Second.
Thank you. Okay, great. Thank you. So as you can see with the agenda, we have the normal call to order. The minutes we'll review in just a moment. Lindsay, if you can just page down a little bit. We will be having an opportunity to hear from Dr. Levin as well as Charlie to hear the data to date and have a good sense of what's happening in our community with different indicators. Then I will be doing a quick update on some public health staffing changes, or not changes, staffing updates that we have. Then I will dive into talking about some amendments to our current Safer at Home order for discussion, not for decision, but just to discuss. And then really this protect our neighbor phase that the state is going to, and sharing with you what we know and what we don't know about that protect our neighbor phase as it starts to get unrolled in the next week or so. Then we want to leave space for that round robin, which we sort of got to last time, but we'll hopefully create some more space to really get to that at the end. So any of the things that you've been sharing with me as far as questions from the community or things that you think are sort of hot topics in the community, and then what can you bring back to the community that you're learning from the Board of Health sessions. So that's the agenda for today. Are there any changes or modifications that anyone would like to make at this time?
No.
Okay, thank you. So at the top of the agenda, looking at the minutes from the last meeting, Lindsay, if you could go ahead and just pull those up as well so we can visually see them. And then whenever you're ready, if I can have a motion to approve the minutes.
I'll make a motion to approve. Jeannie.
Thanks, Jeannie. Any space for discussion?
Karen, you'll need a second on that motion too.
Thank you. Yes. Can I get a second?
I'll second it.
Thanks, Linda. Okay. Any
I'll
space
second.
for, oh, are you there,
Sorry,
Jerry?
Greg here. I was muted. I tried it.
Hi, Greg. I think Linda, we got Linda as a second, so thank you. Any further
Okay.
discussion?
Just a quick question here. You know, as I look at the minutes over the last couple meetings, I noticed that a lot of it is about the procedural, who's present, and then the presentations. It doesn't seem to be much note taking about discussion and stuff like that. I was just wondering if that was something that we want to see more of or not, or.
Thoughts from fellow board members?
Tori, this is, I'm not a board member, but this is John Peacock. The county has moved a little bit more in general to an action-oriented minutes process, with the video record being available for a more detailed review of the discussion if somebody wants to dive into it. And that's been true for the board and such also.
Okay. I personally would think that maybe there should be some more capture. I think in our last meeting, we had a couple of other discussion points that happened. I just think that maybe those could show up, but just going forward, I'll keep an eye on it and just let you know if I still feel that way, maybe even after today's meeting. So thank you for that, John.
So we have a second, there's no further discussion. We'll move on. Thank you. So Lindsay, would you be able to, actually, I'm going to try to share my presentation. Actually, let me pause there. I'm going to have Kim and Charlie share their presentations because they're first up. So Charlie, I think you're first up on the agenda, and then I'll share mine after that. And before Charlie starts, I wanted to mention that Linda was officially approved by the Board of County Commissioners to be our at-large member, taking Christina King's place. So she is official as our voting member right now for at-large.
Congratulations.
Thank you.
Thanks, Linda, for joining in on that.
Thank you.
So Karen, everybody can see my slides now, hopefully.
Yes.
Okay. So I wanted to start off today with someone that was a mentor to me when I got started in public health, and someone I admired a lot. Dr. C. Everett Koop was a pediatric surgeon and the 13th Surgeon General of the United States from 1982 to 1989. He's the one on the left, and I'm the much younger one on the right, sporting a Jerry Garcia tie instead of a bow tie. I always admired how he took a relatively obscure, underfunded department and made it into an influential platform to promote healthy lifestyles and disease prevention. He was probably one of the most famous Surgeon Generals that we've had in our history. In particular, he raised public awareness of the harmful effects of smoking, the emerging HIV epidemic, and at that time, and was a champion of the rights of the disabled. I bring up Dr. Koop because he always took a stand on the side of promoting health, even when his positions may have been politically unpopular. Today, we seem to be at a tipping point where public health messages are questioned rather than understanding our only motivation is protecting lives. Our goal is to work in partnership with governments, businesses, and citizens to protect lives while living with this virus. So Major League Baseball has not gone as far with regard to wearing a mask as you see in the picture here from 1918, 1919 influenza pandemic, the batter, the catcher, the umpire, all wearing masks. But baseball might get to look like what the picture on the left from modern day. They are going to limit spitting, high fives, and they will be playing without fans in the seats, at least for this shortened season that they plan for this year. It seems that social distancing and wearing a mask is somewhat unpopular as a message, certainly as a recommendation, and certainly as a mandate right now, despite the fact that it's a simple collective intervention that we can all take to help protect fellow citizens, protect ourselves, and support the reopening of our economy. When a business is reopened, only to have to close down again, we can quantify that very high cost. But contrast, there is no cost to social distancing and wearing a mask. If we as a community want to see our restaurants and shops open and visitors return, we need to collectively focus on our personal actions, interactions, and responsibilities. Our data will reflect, and we have seen, an increased number of cases recently. Many want to cluster these cases and relate them to a specific business or group. In fact, what we're mainly seeing is social interactions, gatherings, carpooling, and such as bringing infections into the workplaces rather than workplaces being a focus of spread. This was an interesting graphic from the New York Times. It depicts the results of a survey of 511 epidemiologists as to when they would feel comfortable resuming common activities. It's a little hard to read, but I'll tell you just a few of the high points here. Most epidemiologists are now okay with bringing in their mail without precautions. Real risk-averse group there, right? Or seeing a doctor for a non-urgent appointment, or even working in a shared office. Those are the things they're comfortable with doing right now. They responded that within a year, they might feel comfortable eating in a restaurant or flying on a plane. And on the other hand, most of them responded it will be a year or more before they would be comfortable attending a sporting event, a concert, or a play, and a year or more before they would feel comfortable enough to stop wearing a mask or face covering when appropriate. Just something to keep in mind. So there is a basis to the concerns expressed by these epidemiologists, but we continue to refine our knowledge of how and when this virus spreads. In addition to hand washing, social distancing, and wearing a face covering, there are certain situations that are riskier than others, as depicted here in this poster, including closed spaces with poor ventilation, especially for prolonged periods of time, crowded places with many people nearby, especially when others are not wearing face coverings, and close contact settings, such as close range conversations, especially when people are speaking loudly, yelling, or singing. So if you think about Aspen's reputation for intimate restaurants, our large festivals and events, and the social scene in nightclubs, it kind of defines the 3 C's. So perhaps, some of our focus going forward during this time of living with the virus needs to focus on access to outdoor activities, including things like skiing. I mean, skiing is, you're socially distanced, you're most oftentimes wearing a mask. I mean, it might be something that we can even promote as a way, recreational activity that, other than the après-ski portion, fits within the 3 C's. I also wanted to just review this one slide here before we get into this week's data. We're seeing more infections in younger individuals. And I wanted to remind everyone that part of the risk of new cases in younger individuals is that those infections may ultimately be transferred to older individuals, especially with those with underlying medical conditions. This chart above shows that deaths in Colorado in those 60 and over account for 90% of the deaths experienced. Across the nation, as Eagle County actually reported this past week, we're seeing these outbreaks in young individuals even as young as 16 to 20 somethings who are throwing caution to the wind and in some cases being uncooperative with case investigation and contact tracing. Texas, Florida, and Arizona hospitals are at capacity, and governors there are actually reconsidering lockdowns. So we don't want to get there. And we're going to take a look now at where we are by comparison. So a week ago, we had tested 678 individuals and had 38 positives. You can see now we've tested over 860 and have 54 positives. Our positivity rate has crept up to 6.4%. And it's 9.3% for the 173 tests we did in the last 7 days. So you might recall that WHO and CDPHE have set a threshold of 10% for positivity as a measure of whether we're doing enough testing, given that our overall prevalence of COVID-19 is closer to 3 to 5%. So we'd like to see our positivity rate get lower. So this is either an indicator that there's a lot more spread going on or that we need to increase testing to catch more of the people that are not just those that are positive. And this is another chart that we've talked about before. It's a chart of our overall positivity shown on a weekly basis. And so early on in this epidemic, we were only testing people that were coming to the hospital, and that's why it was very high. Now that we're testing many more, it's down around 7%. But if we actually break that up a little bit, the pre-op and OB patient positivity rate that we're doing some testings in the hospital is only 2.3%. If we take those out and only look at medical and community testing, the positivity rate goes up to about 8.7%, which is an increase from last week at 7%. So our positivity rate is rising. And this is an indicator of community spread and that we need to increase tests. And if we shift now from testing to cases, to actual positive cases by when they're reported, over the last week, we had 11 new cases. When you look at this chart, you see that there's a peak in the March-April timeframe, and then there was kind of flat, and now it's coming up again. We weren't testing everybody back in March. So those peaks were actually much higher if we had all of the cases actually reported. So we're not on a par yet with March, but things are picking up. And the 11 cases that we had in the past week, 3 are associated with linked workplace clusters, things that we know about are happening in certain workplaces. 2 are linked to household member transmission. In other words, a wife or a husband tested positive and now their partner tests positive. 2 are associated with restaurant employees that were not part of other outbreaks. 1 was an antibody test from an older infection and will end up getting removed from the data at some point. 1 other one now after investigation looks like it's in Garfield County and it will end up getting removed. So sometimes people have asked questions about why our data goes up and down a little bit, and that's after these investigations. We find out they're actually residents of another county. And then 2 are new and still under investigation. So there's no real clear trend here in our cases per se. We do know about several clusters that in Eagle County and even in Pitkin County and some in Garfield County that are linked between each other, and some of those are linked for some of these cases. This was one of the more interesting charts that I came across through our mobility data that CDPHE has contracted a vendor to put together. And this shows the risk of exposure to COVID-19 from commuters, tourists, and visitors to residents of Pitkin County, depending on the origin of those commuters, tourists, and visitors. So what they did is, to calculate this, is they looked at the prevalence of disease in the point of origin where people were coming from, and then the number of visitors that are here in Pitkin County, and then calculated a risk of exposure from people here in Pitkin County for a random contact with a visitor. What was interesting, obviously there are people within our own county were exposed to. People from Garfield County are second, people coming up from there. In third was Texas. We have a lot of people coming from Texas, and as you've seen on the news recently, the prevalence of disease is exploding in Texas. Next is the rest of Colorado, Eagle County comes in, and then Florida and California are in the top 10 there of risks of infection here in Pitkin County. So as we go forward and start thinking about our public health orders, we might look at ways to ensure that people coming here come here symptom-free, and depending on where things go, relook at other strategies that we might employ to limit that risk. So looking more specifically at our adjacent counties, with regard to Pitkin County, we had 11 cases, and compared to our 7-day moving average, we're still pretty stable. Eagle County's case trend is also relatively stable. They do have the cluster that developed in Basalt and the El Jebel area, which is, somewhat closer to us and, of more of a concern. A week ago, they were at 632 cases, and now they're at 665. So they had an increase of 33 cases over the last 1 week. But keep in mind, they do have 2 to 3 times our population. Garfield County is increasing again this week with 44 new cases and 6 currently hospitalized for COVID-19. A week ago, they were at 199 cases. And now they're at 243. And cases also are increasing in Colorado, pretty much at about the same rate it has for the last 3 weeks. Hospitalizations continue to decline, which is the good news for Colorado as a whole. A week ago, we were at 29,672 cases. So it went up in a week by 1,400 cases, almost 1,500 cases just here in the state. So what does this all mean? The data suggests we are moving into a more cautious state of indications of community transmission and increased need to step up our capacity for case investigation and contact tracing. The number of new cases and unlinked chains of transmission in our county are concerning, as are the increases we're seeing in adjacent counties. Seeing this level of activity may be a reason to consider moving a little bit slowly and not accelerating our reopening, our pace of reopening at least. And to ensure that we're not out in front of the public not yet fully accepting the need for continued adherence to the 5 commitments, public health not yet with a fully scaled up team for contact case investigation and contact tracing, and adjacent counties and states experiencing what we hope to avoid, a return to peak levels that in some areas they haven't seen since March. So if you look at our epidemiology matrix, a month ago, this was all in the green. We were all comfortable in every one of our categories. Now we're starting to see cautious levels in a number of categories. So that's the epidemiologic side. And now we're going to talk a little bit. I'm going to review a little bit about some of the data from hospitals, and then Dr. Levin's going to come in and talk more about that and add some additional information about what's going on nationally as well. So this chart here shows the testing in respiratory tent and community testing. And the choppiness you see is because for a while they were not testing on Sunday. We're going to go back to adding, because of the demand now, to testing 7 days a week. The best measure to look at on this graph are the trend lines, which are increasing. And just to give you an idea, on Monday this week, ABH processed 38 PCR tests, 1 in the emergency room, 3 inpatient, 9 respiratory tent, 13 community referred patients, and 12 for pre-op. So testing volume is definitely increasing. Where the previous graph kind of showed PCR results from respiratory tent and community testing, this chart shows the test results for the ED, inpatients, and respiratory center only, which are medical patients. And that's also trending up. So it's kind of an indicator of kind of the syndromic surveillance of what's happening, how many people are coming to the hospital with COVID-like illness. But again, the good news here for us in Pitkin County is that hospitalizations have remained low. Currently, today, there's nobody in the hospital for COVID-19. But our concern is that hospitalizations lag the increase in cases, and we may not be so fortunate in the near future. So that's just something to keep in mind. And then the third kind of major area within the healthcare system that we look at is the number of healthcare workers who are out with COVID-like illness. There's been a slight uptick at ABH, but we're still not higher than our threshold level to move to a cautious type level. So if we look back at the hospital matrix, and Dr. Levin will talk a little bit more about this as well, our trends in respiratory and community testing have kind of alerted us that we're approaching a more cautious stage. In other words, we're seeing increasing individuals with COVID-like illness coming to and being referred to the respiratory tent for testing. But our other measures of hospitalization and essential healthcare workers out sick remain in the comfortable status. So that's kind of the good news for that side of things. So I just wanted to finish with something about Dr. Coop that where I brought him up originally is he was known for a pronouncement that this is not the time to declare victory in the war over HIV/AIDS, because at the time the war was far from over. And I think we can apply that warning to our battle with COVID-19 pandemic today. The war against the SARS-CoV-2 is far from over. Ultimately, we have to have a vaccine and or treatment. And until then, we need to make sure everybody wears face coverings, masks, socially distances, and does everything they can to prevent transmission. So with that, before I take my slides down, Kim, do you want to, Dr. Levin, do you want to chime in and talk about any of these charts before you put up your slides?
Yeah, thank you so much, Charlie. If you wouldn't mind just going back to the hospital matrix for a moment. And Charlie, thank you for presenting the hospital data this week. I've been working in the emergency department all week and really appreciate you showing and explaining those charts. So, and also just a quick note, I am jealous that you got to stand next to see Everett Koop in a photograph. It's impressive, and he is an impressive person, an individual and lead and role model for us all. So looking at the data that Charlie just presented and the matrix, what's happening over the past 2 weeks is concerning on two major points. One is that there is a definite increase and obvious increase in numbers that are making everyone uncomfortable from the hospital viewpoint. And secondly, it's the rate at which it's rising, which is very rapid and sharp. And so both of those, although we are not in the cautious area, we have touched on it and we're moving rapidly towards that. And so I think that concern and how rapid the rise and movement is of a concern. So the respiratory tent or the respiratory evaluation center, which is called now, hit 10 for the first time, which doesn't leave us in the cautious area, but actually touched on it and is moving in that direction. And the community testing, as Charlie had mentioned, we hit 13 in one day. So we're getting close to these limits that are putting us into cautious. Inpatient hospitalizations, we're at 0 right now. And healthcare workers, we're actually at 5. One went back today, but last week it was at 2. So there is a sharp increase in rise of healthcare workers, and 6 is our limit for moving from comfortable to cautious. So although we're not in the cautious category right now, and we are comfortable on all 3 levels, we do not feel comfortable at the hospital. We see this rapid rate and we see it moving in that direction. And I just want to, it's really basically sounding an alarm for us and sounding an alarm for everybody in the community that, that the numbers are rising, and it's clear, and they're rising in our surrounding communities. There's 33 new cases in Eagle, 44 in Garfield. It's happening around us as well. And so this is more of a feeling of discomfort, even though we're not in the cautious, even though we are in the comfortable range. I just want to really remind everybody that hospitalizations do not move in parallel with community spread. There is definitely a lag time or a delay in when we see people who are really ill and sick from this illness, from this virus, that require hospitalization. So hospitalization data of inpatient, we won't even expect to see this right now. We're gonna expect to see this in 10 days or 2 weeks and rising. And we will look at these and be following them very closely. And then in terms of death data, which is another measure that is looked at locally and on a state and national level, that is even further of a lag period. So maybe 3 weeks out, we might start looking at increase in deaths in the surrounding communities, our community, and in the state. Let's see. So it's basically what we're seeing here is kind of a predictive value of what we may be seeing in a couple weeks in the hospital in terms of hospital capacity. Charlie did mention in Texas, they have hit very high, up to 97% filled in some of their ICUs in Houston. And what they're doing there is they are stopping and halting any further steps forward and opening up. But that is extremely concerning at 97%. And again, that displayed a lag in their rise as well. So Charlie, you can take that down. Thank you. Let's see if I can share my screen here for a second. So this is from the New York Times today, and what it's showing is we have had an alarming highest number of new cases here this week in the nation. So this is what I'm talking about, is this sharp rise. It's kind of the angle of the rise here that is so concerning, not only that it is rising, but how quickly it's rising. And that since there's been a record number of 38,115 new cases in a single day. And the last time that happened was, that has been since April. So this is on the rise nationally. Charlie had talked about it being on the rise in Colorado, and we are seeing it locally and in our surrounding counties. Again, the 3 countries that, the 3 states that are most responsible for this rise are Texas, Texas, Florida, and California. And those are the top 3 places on that kind of interesting table that Charlie was able to obtain in terms of who is coming into our community. Those are the exact 3 states of where people are traveling to here. And they're certainly bringing it in here. I think anecdotally, I worked at Valley View Hospital the other day, and one of the other ER docs said they had a 100% positivity rate for all of the patients that he had seen coming from Texas with symptoms were all, I think it was like a 4 for 4 positive rate for COVID. So people are coming in, and I think that really makes our community more of a challenge in terms of us being Aspen and Picken County being based on a tourist industry, and we are seeing people come in, and it is going to be essential to message everyone as much as possible coming in. And so I think this is one of the main messages today. It's a little blurry, but my mask protects you, your mask protects me. This is very simple. Masks work. If our job and everyone's job is to change this culture so that we all are wearing masks, they work. And the 3 C's, which Charlie showed, close spaces, crowded places, and close contact, this is all common sense. When you are close to anyone, and if you're inside, even if you're outside on a sidewalk, you need to wear a mask. It's a sense of personal responsibility. You're doing this to protect someone else. And when you see someone not wearing a mask, they're not taking the personal responsibility to protect you. And so in a culture of caring and respect, which we really want to try to foster, change this culture of kindness, of educating each other, of making each other accountable for our actions, that you are actually responsible for protecting me. And that's what a mask does. And we know it works. And it really, looking around town, it's, I think if we slowly change, we lead by example and ask others to do so, we're going to change the culture. And in terms of really messaging this to visitors who are coming in, that this is how we do it here, and this is what works. So it's really kind of a plea for social responsibility, personal responsibility, and respect for each other. And creating that kind of culture of kindness and caring in terms of how we want to go forward with it. So it's a very positive focus, and it's a collaborative type of effort. Really, the course of what's going on here, we're at a concerning kind of turning point right now, potentially. The course of what happens is in the hands of all of us. And we can change this if we all follow the 5 commitments, if we follow the rules that are set in restaurants and in businesses. And it's very simple. It all comes down to very simple rule following and respect for each other, and saying, I'm following this rules to protect you. It's very difficult, I think, when, especially for the 20s and 30-year-old crowd, when you go out and you go to dinner, or for any age, you go to dinner, or you go to a social gathering, you don't see it. You don't see the illness. You're not experiencing it. And so it's really easy to relax the rules for yourself. And it's really easy to make the excuse to say, well, my friends aren't sick, and look, nobody around me is sick. So, it's okay not to wear a mask here because nobody's sick and I don't see it. That reality is so hard to bring home and to bring into every single interaction that you have. And you remind yourself of the data that's going on in these numbers, and that it is here, and that we need to somehow bring that reality to each other, that it's here and it's our responsibility to protect each other, to protect each other from this, and that we can literally change the course of this rapid rise that we are now seeing. So overall, similar message that Charlie had from all of this rise of data, which is a simple message, that this is not the best timing right now to open things up. And unfortunately, we're the protect our neighbor, which is what we're going to be discussing today, is about opening up and taking that next step forward and increasing the size of group gatherings and opening more up. And unfortunately, this is not the best timing for it. And so to go forward and continue to move forward, which is our goal through all of this, I think we need to go slowly, and the data right now shows that we need to take very careful steps. We can continue, but we need to continue following the rules, wearing masks, and taking careful steps. I want to mention one more thing that has come up in conversation with the medical advisory team, and everything I'm saying today is on behalf of the hospital medical advisory team as we meet on a regular basis. There is one idea I wanted the Board of Health to consider and think about today is adding a public health clause to the public health order of having it required for any new visitor or anyone coming into the county to be symptom-free for 10 days. So we want you to come here, we want you to visit and follow our public health orders. And this is a public health order where you are required to be symptom-free for 10 days before you come in. I think that this will really, really help to send that message and protect our community. And if you look at what New York and New Jersey is doing or considering doing, that they are considering not allowing any visitors in without doing a 14-day quarantine from a state that is on the rise. So any visitor coming from a state that is rising into New York and New Jersey, they're considering saying you can't come in unless you quarantine for 14 days. This is kind of a similar but a much softer way of doing that. You are welcome to come in, but please be symptom-free for 10 days prior to coming here. And I really think that that's going to help out, and we can potentially have lodging with reservations and confirmations just as a creative way to spread that message and encourage visitors to come, but come symptom-free. And that is all that I have today. I think that's it. And if there's any questions, let me know. Thank you.
Yeah, questions for
question,
please. Brent?
Oh, yeah, I've got a couple of them actually. First off, Kim, does the hospital have access to remdesivir now?
No, remdesivir is limited. It is not in any smaller rural hospitals. Valley View Hospital does not have access to it either. It is only in major kind of university hospitals and tertiary care settings at the moment.
Is that true for this now new within the last few weeks oxygen, alternative oxygen therapy, high pressure, hyperbaric, I don't know what it was, but basically it would delay being intubated for a bit. Do we have access to that technique, or basically if you're real sick, we're getting you out of here?
Yeah, I mean, we take care of as the highest acuity that we can at Aspen Valley Hospital. As you know, altitude at 8,000 feet has a significant effect on any respiratory illness, which is for COVID. And people do a lot better down in lower altitude settings. We're not using hyperbaric oxygen on a regular basis. It's hyperbaric oxygen in itself is not a standardized treatment for COVID, although oxygen is. And there's some kind of pressurized ways that we can give oxygen, but not hyperbaric.
Well, I just wanted to say my general comment is that I agree 100% with everything you're saying. And I'm a little afraid that all of us do too. Most of us, because we're all, holding this conversation and nodding our heads probably in agreement. My fear is that we're not strong enough, and I'm not. I saw the little label there of protect your neighbor or whatever the thing was about protecting somebody else. I saw another one recently that said mask it or casket, and I thought, I like that. Whether it's completely correct or not, the point is it's forceful. My fear, and I'm out, I just saw twice now in a yard, 16 to 18 high school kids with an older adult present playing basketball, no mask. And, I really felt rather bad not intervening in some way, but, not that it's even my place. We're not charged with that kind of thing. And that's what I'm a little afraid of. People are so complacent. And I've watched it time and time again, an older guy, older than me even, just recently, everybody else was masked, and he said, I'm just not going to do it. And fortunately, they kept him to the side. But the point is, we're fighting against this kind of an attitude, and I'm a little afraid that we need to be more forceful. And if states like New York can take the extraordinary steps that they have taken, maybe we should start having more enforceable fines or something. Whether we really push it or they get dismissed, I don't know, but at least it would get people's attention, and it certainly would embarrass them to be called out and, you know, written up or even just given a warning. So anyway, my fear is just we're not strong enough. But anyway, thanks.
Thanks, Brent. Other questions, Anne?
Yep. Karen, are you doing the digital raised hand or just waving?
Good question. I wasn't looking at the digital. I was looking at the waving, but I probably should be doing the digital. I might.
You can do both, but I just wondered.
Yeah, waving's great.
Okay. Question for Kim. Have you kept track, do you have the numbers of people that have been hospitalized and then transferred out to the Front Range at Grand Junction?
Yes. And again, recently we have not had, we've averaged 0 to 1 hospitalizations over the past 2 weeks. We have a total of 4 transfers that were back in April. That's the total that we have. I don't have offhand, although Charlie, you might, the total number of hospitalizations that we have to date, but we've had 4 transfers and they've all been critical and intubated.
Okay, yeah, that just came up today as not everyone realizes that people, as they become more seriously ill, they are transferred to lower elevations. And so sometimes the data about the hospitalizations is a little misleading. Maybe at some point we can address explaining that better, a little more accurate. My other question is, Charlie, what are your 3 C's? I got close, crowded, and what was the last one?
Pull it up for you.
Closed spaces.
Yeah, closed spaces.
Close spaces, crowded.
And close talking.
Oh, and close talking. Okay.
Right.
Perfect. Thank you very much.
And Anne, we've actually done a poster of that with our own logo on it. So I'll share that out with all of you so that you can distribute it as you so would need to or like to. Yeah.
Corey, I like the 4 C's. Add close talking.
All right, Greg.
Hi, thank you. Thanks for running this, Karen. I've got you loud and clear. Finally, I'm in. I just had a couple of questions from my associates on the board of county commissioners. George was asking regarding contract tracing and what type of testing is done, if any, when and if a quarantine is imposed. So somebody is tested positive, the contact tracers reach out to everyone they've talked to. Are those people then tested, is the question he's asked, or are they just put into quarantine? Or can you describe the protocol again?
Sure. So 2 different situations. You know, if you test positive, you're put into isolation for 10 days. If you're a contact of somebody who has tested positive and you develop symptoms, we would recommend testing. If you're a close contact and you're asymptomatic and you're quarantined for 14 days, we would not recommend testing right away. There's no reason to. If you get tested at all, it would have to be after 7 days, but it doesn't shorten the quarantine period because a negative test doesn't necessarily mean that you're negative, that you hadn't been exposed in the last couple days. So.
Great, thank you. If I could, that helped. I think that answered the question. The other was just underscore the point that's already come up that our 3 largest tourist or origination areas are Texas, New York, and California. And certainly our board is looking at this as well, looking at the headlines in the newspaper today about the packed air flights. Suggesting a quarantine or an isolation for 10 days is something that we would, I'm sure, love to speak more about. I'm just wondering what other testing protocols or screening protocols could be implemented at the airport. I know we've talked about temperature testing and how it's only marginally, or maybe, it's all a numbers game, right? A percentage of people might be interdicted, but it seems like a percentage is better than none. And I'm just wondering, what else are we doing in the way of of doing targeted testing and targeted screening of people, if anything.
I think I'd let John Peacock weigh in on this in terms of what's allowable for us to do, even from a legal point of view. You know, there's the value of doing some sort of symptom screening is something that we're looking at either on a voluntary or, you know, or having people there, and certainly through signage and other things. You know, there's certainly the approach that Kim outlined, which is, you know, before people get here, ask them to voluntarily be symptom-free for 10 days before you show up. That is not going to preclude them from coming. You know, obviously we had somebody in the respiratory tent, I think today, that was an international traveler test positive. But, you know, we could also maybe use some electronic methods. We're looking at that as well, where people could opt in to an app to give us information about where they're staying in case we need to contact them for contact tracing. So there's a variety of things I think that are being considered. Now it's a matter of, you know, what's allowable, and trying to avoid going back to a 14-day quarantine of anybody who comes in, which, you know, would be very restrictive. So, John,
if I could clarify that, is that 10 days of isolation once they get here? It seems if they do it before they travel and then they get on an airplane, it's almost like a reset, isn't it?
Yeah,
Right.
I think that my original recommendation was 10 days of symptom-free, as Charlie said, symptom-free for 10 days prior to arrival. So please do not come here with symptoms and then figure you should get a test when you get here and find out you're positive. I think the risk of getting on an airplane and you know, having transmission on the air themselves in that process, but it's just the request to be symptom-free for 10 days so that, you know, you're not voluntarily bringing the virus into the community, knowing that you have symptoms.
Yeah, so Greg, as Charlie indicated, we're looking at tools like Pick and Alert and such. I you know, would invite John Ely to weigh in, but we're finding that the symptom screening and such, it needs to be a voluntary activity. We are focusing on the social distancing aspect. We have received 30,000 masks at the airport, which we are distributing along with the information regarding public health orders, the 5 commitments to containment, how to get tested. I would note that our testing numbers, and Charlie or Kim, you may be able to refer to this more specifically, but do include a large percentage of visitors who do become symptomatic. I think our most successful strategies are really getting the visitors who are coming in the information that they need to understand the 5 commitments and the testing, and not only engaging the airport in distributing that information, but also our lodging partners and other community partners that actually may have earlier, more frequent touch points with visitors than just that single point of entry. We do know that during the summer, and even though our load factors are going up on flights, our number of flights are still way down. And we know that during a normal year, most of our summer visitors are coming rubber tire. They're coming on Highway 82. I think that is even more so the case right now. So it's really the multiple channels that we need to be working through to make sure that our guests know and follow the 5 commitments. But we are continuing to look at those electronic options for how we get screened, and also working through what we're allowed to do and require on the screening. side right now. But we've got a lot of information out at the airport, and thankfully a lot of masks now. And those are getting handed out in groups of 5 masks.
Any other questions for Charlie or Kim before we move on in the agenda? And then Greg, if you want, oh, Jeannie, great. And then Linda, and then Greg, I'll turn it over to you after this. So Jeannie, go ahead.
I just have a comment. I was listening to Jill Hunziker and Jared Polis yesterday, and this is about the complacency of young people. There's so much asymptomatic spread, but he said that if 20 young people or 15 young people in their teens and 20s get sick, one of them on average will go to the hospital. And I don't think people here know that, and they'll be sick enough. And if they spread it to a parent in their 60s, that parent has a 1 in 3 chance of going to the hospital, or a grandparent in their 70s, that's 1 in 2. So I think people have to be aware, and they have to assume that everyone they come into contact with has, even if they have no symptoms, could be carrying COVID. And that's my comment.
Thank you. I think the information we're getting around teens and youngsters is pretty, it's different than what we were learning before. So thanks for sharing that. Linda.
Yes, hi. I have a question for Kim about testing, because I have patients that are calling for testing, and all of a sudden I'm given a piece of paper that requires me to send to the hospital symptoms that the patient may be having, which then lends itself to another phone call. And I'm wondering if the testing should be somewhat easier to obtain for people, even people that are coming here and all of a sudden are sick and don't have a doctor here and have to then go find a doctor to, or call someone to then actually be tested. And I'm thinking that it might be behoove us to make testing a little simpler for people, not only the people here, but the people that are coming to town.
Yeah, thanks, Linda, for that comment. That is a very real issue. And one question for you, is it just that in terms of filling out the symptoms, that becomes a barrier or makes it more difficult?
Well, it makes it more difficult when you're seeing patients in the office and it's a really busy day, and then somebody comes and says, this patient called, she wants to be tested. Here's a paper that you're required to send to the hospital stating what her symptoms are, which then I have to find the time to call the patient and go through that whole list, when in fact, maybe it would be simpler to just allow her to go to the hospital and get tested if they want to be tested.
Right. So I think through this entire pandemic, one of the very limited resources has been testing. And we're doing a great job at the community testing center at the hospital, testing everybody that has symptoms. And that is the goal right now in terms of the goals for public health. If you have symptoms, maybe if you can just have, and that doesn't need to be a really inclusive list, at least get one or two symptoms, top 2 symptoms on that list when whoever fields that phone call to say, hey, what are your top 2 symptoms, and just circle them. Make it easier on yourself. But unfortunately right now, a test requires a doctor's order. And so the logistics of that makes it harder for all of us to have a very simple and easy testing center where you can drive up and say, hey, I just want to be tested. And our goal is to test everyone who has symptoms. That's the most important part.
Yeah.
So we're trying our best to create that system, and every test needs a doctor's order. That's not our rule. That's from the testing center, from the labs. And we, so we're working with that, and we're working within that constraints, and we are trying to make it simpler and more streamlined as we go through. We imagine that there will probably be more of a demand for testing and trying to meet that demand.
Right. Thank you.
Can I add on to that? Because Kim, I think there's another element around this, around the challenges and sometimes benefits of asymptomatic testing and the potential for false negatives. So there's actually, I think, a reason that their symptomatic testing right now is encouraged, because there is the viral load question and the false negative question. And even the asymptomatic testing is more recommended, as I understand it, from the hospital, 5 to 7 days after a confirmed exposure, to give the virus time to I don't know, I guess get a certain load. You know the right terminology. So I wonder if you might speak to that just a little bit, because that, I think that's the other reason that we don't just test everyone that calls and wants a test.
Yeah, I mean, there's definitely issues of sensitivity and specificity, false negatives. I think, again, in like from the beginning of this pandemic, testing has been a very limited resources. It still is, and we're working with the best that we have. In the ideal epidemiological and pandemic world, you can test anyone at any point, large volumes of people, asymptomatic, symptomatic, and work with the numbers in terms of sensitivity and specificity. But it's a limited resource, and I think we're doing a great job offering it to making sure that anyone who has symptoms can be tested. And if you can just work within those guidelines right now, in terms of asymptomatic testing, there's all kinds of scenarios that are coming up in terms of some states that require a test, a PCR test before you enter the state. Or now there's so many scenarios coming up with work and going into group environments and people wanting a test before they visit, a family member who is older and doesn't want to and wants to have a little more of that reassurance. The following the 5 commitments, again, I know it's becoming this repetitive type of thing of follow the 5 commitments. If we play by the rules, we're going to decrease viral spread no matter what. Yes, there are asymptomatic people who have it. We don't know how to choose that group and test them. And so without having to test an entire population because you don't have the resources. But there is some asymptomatic testing, and you can talk to your doctors. Some doctors will order a test which is asymptomatic. That's the saliva test through the hospital lab, not the PCR symptomatic testing, which is just limited to the community tent, is only symptomatic. So asymptomatic testing is through a different avenue, and that's through the lab at the hospital for those cases that a physician feels that it is needed to test someone who's asymptomatic in the scenario that they're in. But we're continuing to evolve. It's still rapidly changing, and resources will continue to improve with testing, I think, as we go through this.
Hey, Karen, I know, thanks for chairing today. I appreciate you pinch hitting here. I know Tori had questions teed up, and I want to make sure we hear from him, but I also know we're about 20 minutes behind already, so we're going to be moving quickly. Thank you, but Tori, please go ahead.
Thanks so much, Greg. I did send out an email with a couple of questions on it. I'm not going to refer to that right now. I have a few quick ones that I wanted to get to. First, John Peacock, you said that you have 30,000 masks that have arrived for the airport use. How long do you suspect that supply lasts you?
Yeah, that is a really great. Sorry, my video isn't working all of a sudden. That is a really great question, Tori. I think it is. The airlines have obviously been challenged in terms of figuring out what their load factors and such are going to be. But that will, I think, right now, pretty easily get us through to the fall and down season for sure. Because, like I said, most people are coming through on Highway 82.
Yeah, I appreciate that. And that's kind of why I ask is that, one of the few things that we know that we can do is those 5 commitments, containment, and a mask is very high on that list. So the city has really undertaken an effort to get some masks on the streets to people that don't have them or aren't wearing them. And if the county's participation could help us in that effort at all, I think that mass distribution is one of the strongest things that we can do right now. With that being said, and I'll be glad to connect more with you and just talk about a collaborative plan there, and if there's any associative that we can make there. I just want to use this opportunity because I do want to move through the agenda on the right timing. I want to support what Linda was just saying. In another sense, you know, we've heard of some cases coming up in town, and you know, there's been people that have requested to get tested because they may have had close proximity to somebody and can be concerned about it. I would love to see that testing capacity is expanded to at least some of those people that feel like they have been in a situation of possible contact. But overall, I just really, once again, want to support the ability for people to get tested. And I'm not talking about just everybody or anybody, but people that have had those possible contacts with somebody tested positive. I'd love to have them be able to. We've had some cases in restaurants and such, and some of their other staff members have requested testing and it hasn't been that available. I'd love to see that be available. And then I think as I and some others have suggested earlier, is that voluntary basis of letting some of our visitors that are coming in on a voluntary basis get a test. One thing I'll share with you is I know some people that have come to town recently from California, and they actually, before they traveled here, they went and got a test. For them, it was as easy as making a phone call and getting an appointment for the very next day and getting results back within another day or two. I know that our capacity isn't exactly the same, but it's wonderful to know that there are some people out there that are taking that measure if they can. And again, I just want to be supportive of what Linda was saying about making testing a little bit more available to some people that may have had that contact. Once again, I'm going to use this opportunity to ask a question about the antibody test that we got. The antibody test that we got, we did a validation test with those, didn't we? We utilized a few of them to see if they were working or as much as possible. And if that's the case, again, if they're sitting on a shelf, I would say that we should be using those and deploying those. Everybody knows that they don't mean that you can't catch it again. Everybody knows that it doesn't necessarily mean that your negative is a true negative or your positive is a true negative. But I know people that have really learned from that and enjoyed that experience of getting closer to knowing where their system is at. So, and it hasn't changed any of their behavior. They're still being as cautious as ever. So I just want to put in a word from the city side that we are supportive of testing. We'd love to see that availability be utilized as much as possible. And I know that we have capacity issues there, but I think that testing is one of the few things that we can also be doing. So I'll use my time for that and send it back to you, Greg. Maybe we'll get to some of those other questions that I sent out a little later.
Thanks, Tori. Important questions, and this has been a very important conversation. So we haven't wasted any time today, that's for certain. It's an information-rich dialogue. So Karen, I'd love to get to your director's report if that's where you are now, and I know your eyes on the clock as well. So let's see how it goes.
Sure. Yeah. Thanks, Greg. I am actually going to jump into the presentation because I think there are some pieces there that are salient to the discussions we've been having. I am going to do my best. Actually, I'm going to have Lindsay share it. Lindsay, if you can do that. Thank you. Perfect. So, oh, yep. You can go to the next one. Everybody can hear me okay? Great. All right. I think you're going to see a theme through Dr. Levin and Charlie's presentations and with mine that we're really looking at this notion of where are we in our community right now and collectively across the nation. And Dr. Bonnie Henry is the medical, the public health director, the medical director of British Columbia, so Canada. And she has really been an amazing leader through COVID-19 and really has brought a real strong sense of leadership and solidarity throughout British Columbia. And we're seeing a little bit of a different stance in Canada toward public health than we might be seeing in the US right now. And one thing that Bonnie says is, you know, be calm, be kind, and be safe. And I would really like to just kind of have that echo through all of our interactions and the way we think about moving forward as a community through this pandemic. So what we know is what Charlie and Kim have talked about is that we're starting to see an uptick in cases. We're starting to see us moving into more of a cautious zone. What we also know is that this was expected. You can't lift a suppression strategy when COVID-19 is still in the community without having some sort of resurgence of COVID-19 and SARS-CoV-2. We knew that it was still in the community, it was just greatly suppressed. And so we're starting to see higher transmission rates in our community because of the nature of lifting suppression and having more activity happen in our community. So it's not unexpected, but what we want to make sure we have are the systems in place to be able to go back to a containment strategy. And I'll talk a little bit more about that. But this is sort of this shift that we're having happen in our community from a pretty amazing suppression strategy where, you know, I think we were, when we look at the mobility data at one point, Pickens County was A+, we were the top of the like 3,000 communities. So people were really, really taking it seriously, and they were really restricting their social movement and really increasing their social distancing. And so I totally believe that this community has every ability to continue to do that. Unfortunately, when I looked at the mobility data this week, we were at a D-. So we've definitely, you know, as we've started to increase activity in the community, which is what happens when you start to allow more things to happen, people start to move around and do more. But our mobility is probably not exactly where we want it to be right now. So when we've talked in the past about social distancing and maintaining that 65%, I think that that's a critical message for our community to understand and to think about. How do you reduce your social activity by, you know, even if you're looking at 65%, what does that mean for you? And to think about that. So again, we know that the virus is here. We are learning to live with it until we have an effective vaccine that's widely distributed throughout the nation. And we also know that we're interconnected, that unfortunately, you know, as much as we would like Pickens County to just be Pickens County, we are interconnected with the Valley, we're interconnected across the state, we're interconnected across the nation. And so what other communities do impact us. And so we have to think about that. And that's some of the data that Charlie brought forth with even Garfield and Eagle data, and then the national data of who's visiting us. So I think we have some strategies. I know we have some strategies that we'll be sharing with you in regard to Kim and Charlie's note of caution. That will be my note as well as we start to talk about the public health orders and what that really means for our community. You know, we've been doing this rolling basis. Maybe we need to slow our roll a little bit and think about that, giving ourselves a little bit more time, but I'll talk through all of that with you. So Lindsay, you can advance the slide. So this is just, again, you may have, we've looked at this in the past, but you know, this is sort of a pandemic response. So you have your preparedness, you have your containment, you start to see sporadic cases in containment, you start to see cluster of cases in containment, then you start to see that local transmission and community-wide community spread where we can't trace cases back to their original source. Then we would have some sort of suppression stage, and then you see those little blips in the suppression. So, and eventually when you get to a vaccine, you're in a recovery stage. So when we think about this, you know, we really did, when we had our first community spread, we went into that mitigation phase, we put in our first public health order, and then with the stay at home, that was really a truly suppression phase of this response. When we started to lift our suppression, we've really gone back to that containment stage. And right now we've been seeing these clusters. So that's what you've been hearing about in the media, as well as just through our channels of communication. And so we really want to think about what are we doing around those clusters of cases, and what are their strategies that we're employing. And you're aware of these, but I'm just going to kind of bring them forth again. So next slide. So that you've seen the slide in the past as well. We talked about the public health order as a suppression strategy, a really blunt tool like a hammer to kind of just flatten that curve really quickly. When we start to lift that suppression strategy, the curve starts to inch up and increase, and that's the dance. And so we're going to see these little blips. And what we don't want the blips to happen into is overwhelming our healthcare system or starting to see a lot of people with severe illness or a lot of mortality. Those are the things that we have as our goals to try to prevent. And so the box it in strategy is this individualized strategy. So it's not a blunt tool, it's a more finely scalpel tool to really be able to contain, going back to that containment stage of the pandemic response. And so that's where we are right now. We still have a little bit of suppression. We haven't lifted everything. The public health order is still in place. So we have a bit of suppression, and we also have this containment strategy to really deal with these cluster outbreaks that we're starting to see. Next slide. So we can go to the next one again. Thank you. So this is going to fall right in line with Charlie's slide. How do we prevent cluster outbreaks? And Lindsay, if you can hyperlink on the by avoiding the 3 C's. So there it is again. So just a reminder of that. Okay, now we can go back to the slide presentation. So just a reminder, repetition here. So thinking about social distancing. Next slide. And just thinking about this was reiterated of finding your why. So why do you think that social distancing is important as a community member? Is it because you have an immunocompromised child at home that you're trying to protect? Is it because you have grandparents coming over to take care of your kiddos and you want to make sure that they're protected? Is it because you don't want to bring an illness into your employer and have your employer have to shut down because they have an outbreak? You know, I think finding your why of why you want to think about the 5 commitments to containment, why you're going to increase your social distancing, finding the reason for you that matters to you. We've talked about how to evaluate risk. And so when we talk about the public health amendment and the protect your neighbor order, I want you to look at that far right corner where we see the highest risk. And that's why you've seen an evolution of the public health order, where these are some of the last things that start to open up because they truly are the highest risk with the number of contacts and the contact intensities that are happening. So bars, concerts, festivals, large social gatherings, conferences are things that we are still really evaluating because we know that those are the highest risk categories. Next slide. This is just a basics for how businesses can mitigate risk. This is what people are doing, businesses are doing through their business safety plans. Next slide. And next slide. So these are all the things that we're implementing to really have the best public health practices. And to Charlie and Kim's point, it really takes the individual, family sector, and community buy-in and diligence to all of these practices. Next slide. So we had created this phases within a phase of phase 2, and this was something that we shared with you in the past of how we were doing these rolling openings. There are a number of things that we had on the docket to open tomorrow with a new public amendment to the public health order. Again, these were the rolling openings that we were doing to better align with the state phase 2 or safer at home order. So these were all planned and we still are planning on doing these tomorrow. So I want to go through those with you. Next slide. So we have drive-in events. These are, all of them are subject to the stuff at the very top of the slide. Again, these are events that are fairly risk-free because people are in their cars watching a movie or watching a concert. They're similar to what how the graduations happened in this community. We feel that they're low risk because people are contained in their cars and not milling around and having the 3 C's kind of as a thing that we're trying to avoid. And so because they're outside, they're in contained spaces, and they're not in close contact with other people. Lodging, we have been more restrictive on lodging, and at this point we are morphing into 100% capacity to allow for lodging to have that option. I'll let John weigh in on whether that is even something that is feasible for lodging right now, but this has been a place where we have been we've been more restrictive than the state overall, and we had talked about and planned on getting to 100% lodging by the end of phase 2. Museums and places of public accommodation, this was a little bit of confusion with the state order, but museums are now allowed to open, and the recommendations is that they just have fewer than 10 individuals per room. We don't feel like this is a high risk category, and if you think back to that risk analysis, they were not in that high risk category. Residential camps right now are allowed to open at the state. They can operate within groups of 10 indoors and 25 outdoors. We are paying special attention to residential camps right now just because there is an outbreak in a residential, not with the kiddos, but with the staff of a residential camp in El Paso County. And so we're paying close attention to that right now. So I'm going to stop there and just see if there's any questions about these proposed or planned, I should say, openings that we had within our phases within a phase 2.
Thanks, Karen. I certainly have a question. I wanted to look to see if anyone else has a comment or a question. Kim, was that a hand raise or just a?
No, that's a question too. I got a question.
Okay, Brent. Sure, Brent, go ahead.
Well, all I was going to say is, I'm not sure, and I'm not a scientist, and I'm not there exactly at the point of contact, but my intuition tells me I'm not afraid of a hotel. They're going to some pretty big expense and effort to keep things hygienic. What I worry about, and I've said it before, is the individual compliance, and the individual compliance when it's not being either coerced or encouraged. When you go into a restaurant, if there's a sign and you see others, great, you mask up. But the rest of the time, and again, there's the example of these kids playing basketball, once you get out loose, it breaks down. And if that's an area of an infection, well, then they go back into normal society and but into the normal flow of things, and then we've got a problem. And so, my feeling is somehow we need to figure out a way to get better individual compliance without just, again, I guess Kim even mentioned it, but get into the psyche of people to change the attitude. And some cultures that would be easier to do because they have a higher level of respect for elders, for anybody that's older than they are. We're sort of the opposite, and this is tough. Anyway, so that's just my little contribution.
Thanks, Brent. If anybody has a hand, you may just want to yell at me. I'm looking, but I can't tell all the time if somebody wants to say something. It'd be great if we could all demand 100% mask compliance and social distancing from our family and friends. And I know it's hard, but it's something we can aspire to, and we can certainly ask the public to do that. I'd like to know if our lodges and our restaurants are willing to demand it forcefully or not allow service. If we could, I don't know if we can demand that of our businesses locally, but when I'm listening to people, constituents and people online who are talking about their experiences, often they have people who come in and say, I'm not going to wear a mask in your restaurant. And what we need is the hotelier or the restaurateur to be able to say, then I can't serve you, please come again when you're ready to bring a mask. And that's it. There's no negotiation. I kind of think I'd be willing to allow and advocate for hotels expanding their a little bit, or restaurants, but they have to be able to insist on that, and the business owners as well. And I know some are and some aren't, and the ones who are willing to make that insistence are really shocked about the ones that aren't. So how can we get the community on board with this? This is a question I'm asking. I don't have the answer. I see Tori and John both want to speak. Tori first, then John.
I was going to say, and Kara's on here too, because she's been working with ACRA on this. So I'd like her to be able to just share a minute.
I appreciate that. I'll defer over to John because he might have an answer on that. But Greg, I support what you're initiating there. And I would say that if that was something that was done through strengthening the health order and making that official, I would support that as well.
And I was actually going to invite Kara to make comments also, because I know she's been working with that industry, with the industries and having some of those conversations. So Kara, if that's okay, Greg.
Yeah. So
great, it'd be great to see her.
So thank you, Greg and Tori. I think that's a great segue. We, this week, in partnership with ACRA, actually hosted a sector check-in with both the restaurant and lodging community, which is where some of these recommendations for the amendment came forth from. And we heard a lot of great feedback about, from the restaurant and lodging community about the guests that they're seeing and how that enforcement and education is working with guests, specifically on the mask piece of it. And so I'll sum up 2 hours in 90 seconds, so forgive me for brevity. But really what we heard from the restaurant industry is that when the managers are there, that it's very easy to provide that education and insist that to the guests. What they are starting to work on is with their hourly employees that are busy shuffling people and trays. It's another ask for that level of employee. So they're starting to implement some of those trainings, almost kind of crucial conversation trainings with their employees of how to do it. So maybe not to the insist level that you guys are speaking of, but how do we train all employees to feel empowered to have that conversation? They recognize that's a place that they can really step in. And then from the lodging sector, really acknowledge, you know, we can be a partner and have a lot of this messaging of that right now they're required of at registration, like when they make their reservation, they're required to share the 5 commitments and share their protocols with customers, but we can really work with them to really improve additional education measures of how they can be working with the guests when they arrive, when they're leaving for the day, and really starting to build up that partnership with the lodging community is really where we're starting to head with them.
Great, Kara, thank you. It occurs to me while you were saying that is really the customers themselves are going to be voting with their wallets, their pocketbooks. If they don't feel safe, they're not going to go in, whether it's a restaurant or hotel. And if the hotel, restaurant, or business can explain that to any customer who doesn't quite understand it, that their economic survival may depend upon people voluntarily complying, you know, perhaps that's a good part of the argument. I don't know, but I certainly hope to see more of that, and it would make a lot of people in the community feel much more comfortable if we saw more of that. Getting to the basketball court, Brent, I don't know if anyone else has a comment on that one. More signage.
Yeah,
I'm looking further. There you go.
I was almost tempted to, you know, I would have, my God, I can't imagine I would never have been allowed to you know, forget it, but I was almost tempted to go over there and say, you know, really, does this seem, you know, intelligent to you? And somehow, you know, we're not there yet. And I think if we had a higher level of social compliance, because I've seen this in other countries. I've watched people approach other people that they do not know saying, hey, whoever you are, shape up. That's not the way we do things here. And we're not to that point yet. And I think it would be great if we had a stronger threshold at the restaurants, because that might be one of those funnel points that would start to change behavior. If the restaurants are taking it seriously in other places, well, then maybe I should too. And we get to a little higher level of general compliance.
We'll all back you up if you decide to go after the basketball court. We'll be behind you. We'll be with you. Okay, I'm ready. Okay, I'm looking, Karen, back to you if I don't see any other questions, comments. Bill Madsen. Billy, there you go.
Yeah, thanks. I think I'm really hesitant we don't have a lot of resources to force, you know, compliance. And I think education is really the critical component. And if we really do want to have people masking up, I mean, I think we should, as we have at the airport, invest in masks for our community. So if a restaurant decides to say, hey, no shirt, no shoes, no mask, no service, let's provide them with the tools when a guest comes up and says, wow, I really wanted to eat in your restaurant, but I don't have a mask. You know, let's be in a position to give them the mask. I really also think that reaching out to our guests, as Kim had stated, and just saying, hey, if you're symptom free, we want you to come to our town. And I'm fully supportive following the state and moving our lodging to 100% capacity. It certainly is a challenge here in Snowmass Village, where during the week, 50% is probably not an issue. But when it comes time for the weekend, adhering to that 50% capacity is, number one, very hard to enforce, but also it's a challenge for us as a community. Thank you.
I think
John, I think we had Brett and then John, or.
Well, I was just thinking, I think a wonderful, I don't know whether this is probably impractical, but just think about it. If we had some masked rangers, so to speak, if we had people who were distributing free masks, I don't know how this would happen, but you're walking downtown, you see a group of people that don't have masks, you say, please, have a few masks, please. And that also might change people's thinking that if the city's going to this effort, or again, the county, maybe I should pay a little more attention. And again, stepping up this kind of personal compliance and responsibility that maybe is not quite there yet. Anyway.
Yeah.
Thanks, Brent. John?
Yeah, and I just wanted to build on what, Brent was saying. This is a cultural issue, and cultures don't change quickly, right? But they do change with persistence. They change with a consistent leadership voice. We have a lot of elected officials on this board, citizen leadership on this board. The consistency of your message, the consistency of messages from our councils and boards of commissioners about this personal responsibility and persevering. We've got to be the water that's grinding the rock down here and have our eyes on the long game, because this is for the next 18 to 24 months. And so I think these conversations and continuing to leverage your leadership positions to be consistent with these messages, it won't happen as quickly as we like, but it is happening. There is a lot of compliance happening out there, and there are problem spots. And I think the consistency of our messaging and the messaging of the leaders here is what leads to that culture change, Brett. And it's not going to happen right away. So I just wanted to make that point, that and building on Bill's comments, it's not going to be about us forcing it through enforcement. It's really about the voluntary compliance.
Thanks, John. While we're talking about us being on message, I just wanted to thank Jeannie for her great letter to the editor. And I'd love to encourage our board to get more involved with letters to the editor, backing up Karen and Charlie and our public health department, just so that we do have a united message and that we're disseminating this information. I thought Jeannie's letter was very good, and hopefully we can all be submitting op-eds or letters as we go forward. I see Tom has his hand up.
Yeah, I agree with Bill. I think it should be popular and stylish to wear a mask. And if you had a mask that said, I heart Aspen, I love Aspen, and would give a free mask to everyone when they come into the airport, then it would be popular and a thing for tourists to wear such a mask when they arrive.
Great idea.
I'd love to see some designers coming forward with something interesting, and let's make masks, something you can't leave home without. Okay, I think if I don't see any more,
Rick?
oh, somebody's asking. Yeah.
Yeah, I've had a hand up for a while.
Ann. Oh,
Yeah, thanks.
Ann.
Actually, to your last comment, there have been some really terrific fundraisers where different artists contribute custom masks, and we could do something like that. That's kind of an interesting idea. In response to first, John, thank you very much for John Peacock for summing up what we need for cultural change. But Brent mentioned it, and then Kim just in the chat room mentioned support of the masked somebody. We are working, the city's working with ACRA to come up with an ambassadors that can be handing out masks, walking around downtown, educating, answering questions, much more education than enforcement. This is happening around the country. Chicago just started today their social distance ambassadors that are primarily on the lakefront. And again, a very friendly group of people going around and just informing people this is what we need to do to protect ourselves. So I can't wait for that program to get going. I think, and Tori, you may know more, but it should be in the next week or so that we get those ambassadors walking around the core. Secondly, in terms of occupancy, as you've all seen, a lot of people are coming into town, and they continue to come whether our lodges are at 50% occupancy or not, because they're doing Airbnb and VRBO. I actually would prefer we open it up 100% because I have much greater trust in the lodges to get across the message of what visitors need to be doing and educate the visitors than I do the other short-term rentals. So while it seems kind of counterintuitive, you know, I would be supporting opening lodges to 100%.
I agree with you, Ann. I agree with you, Ann.
Thanks, Tom.
Tori?
Thanks. The city council as a whole is supportive of the hotels moving forward, but we want to know that some of these precautions are being handled as well. That screening, a questionnaire of screening, invaluable. Dr. Levin's suggestion of pledging that you're symptom free for 10 days before you get here. These are the kind of things that we need to put in tandem, not just say that we're opening to 100%, but that we're doing other measures that are going to support that being done safely. I have one quick question with Kara on the line. I've gotten a text here that just simply asks the question, as we talk about lodging and restaurants, are lodging allowed to host groups of 10 or more, and are restaurants still limited to parties of 8 or less?
So to depict that a little bit, anyone being seated for dining, tables may not exceed 8 per table. Restaurants that may have space like for private dining or wanting to do a private dining event need to complete an event safety plan and follow the event guidance for that type of seating. So that's on the restaurant side. And that is, again, per space capacity up to 50 people. And then that same line of thought happens for lodges too, is that say a lodge has a conference space that they need to complete an event safety plan. And it's up to 50 people with appropriate physical distancing.
Thank you.
Okay, I'm still looking. I don't see any of their faces here. Hands up, back to Karen.
Great, thanks. Lindsay, can you bring up the slides? Great, okay. So this is, I won't go into excruciating detail on this. We're changing a couple other things with the public health order as of tomorrow, just on some verbiage to match the state. So this isn't an opening. This is just verbiage about aligning with the state language. So I'll stop there for a second, but hopefully there's not any questions about that. Okay. Next slide. So these are, this is where I want you to kind of put on your hat of the information that Dr. Levin and Charlie shared with you, is that we have these openings that are taking place tomorrow that we have been planning on. We have said that when we are doing some major changes to the public health order that we want to give 4 weeks at least to really see the impact of those changes. Given where our data is right now, that feels very prudent and something that we would want to continue to do. So with that, there are some other things that the state has chosen to go ahead and start to open. which includes having bars open at 25%, which I believe took place maybe this week. And then there are a couple other items that we feel at this time it would be better to wait and see how the data plays out in the next few weeks before we do any other changes to the public health order, minus the ones I just talked with you about for tomorrow. So recommendations, and again, this is just for you to give us advice on right now, but our public health recommendation, and Dr. Levin, I think you would concur with the MAT's recommendation, is that we would wait to open bars to see, again, how the data responds in the next few weeks, pushing that out either for 2 weeks to July 10th or potentially 4 weeks to July 24th, even though the state is allowing bars to be open at 25% capacity. The other place is that if you look at the high-risk categories, we know that mass gatherings and event size continue to be a place where not only is it a high cluster of kind of people together, but that contact tracing can be difficult in regard to mass gatherings or big events. It just adds a level of complexity that is a little bit unique. And so when we're thinking about building out our capacity to be able to do contact tracing effectively and contain the virus, and we look at the impact of these mass events, we feel like this is a very high risk kind of category and that we should hold on group sizes right now. And we do not make any changes again until we're looking at potentially 2 or 4 weeks out. And that's, you know, if you want to weigh in on 2 to 4 weeks, I think, again, our recommendation has always been, let's give it 4 weeks time when we make significant changes to the public health order to see how the life cycle of the virus and how the data responds. So I'm going to stop there and just see if this is concurring kind of thinking and philosophy with this group, but this is our recommendation right now, that we do not align with the state on these two things.
So Karen or John, will we need a motion from someone to adopt this, or are we just giving a thumbs up to the direction we're recommending you go? I guess we could just give a thumbs up here. Is that right?
Yeah, I think thumbs up to this direction.
Okay, I'll try to chart the thumbs up. Maybe Lindsay can help me on her end. Just make sure we don't miss anyone. I can only see a few of you at a time during when the image is up. I have a question from Tom to start. I've got a thumbs up from Jeannie though. But wait a minute, I want to make sure we know which question I'm asking. Tom.
I'm voting for it. I'm voting for it.
Okay, so that's actually a thumbs up, and Jeannie gave us a thumbs up. How are we doing? I've got one from Charlie. Let me go back and look at my screen. I just want to make sure we're not seeing it from several others here. I don't see several people. Tori, you're not going either way.
Yeah, you know, there's so many questions that surrounds this. You know, for example, you know, a bar that operates with seating and with table service and really abiding by the guidelines that are in place for restaurants, that would be something that I think we could all support. But when you talk about opening bars to 25%, I think what everybody imagines is, okay, so now you've got 25% of occupancy, but they're all hanging out at the bar. So like, how do you really kind of quantify what we're looking at there? It's just a very ambiguous almost question, a very difficult question to put your finger on. Obviously, I have not had direct conversations with the rest of my council about this provision, but I know that we want to err on the side of safety and public health. But again, you know, this kind of question is just a difficult one to understand the ramifications of and how it's played out, and again, how enforcement and compliance would be held accountable.
Right.
Yeah,
I have the same question.
Sorry, Greg. There isn't guidance yet, Tori, from the state on this, and that's one of the another reasons why we want to hold, is because we don't completely understand what this means. It just comes out, and then there's a lack of guidance that we can't follow. So we need to have the ability to work with the sector, create that guidance, feel confident that we understand what that truly does mean for the community.
Yeah, along the lines of what Tori said, I'd very much like to discuss this with, or we need to discuss this with the rest of council. But preliminarily, I would support this. One, because, yeah, it isn't clear how you could enforce this kind of thing, either the group size or the bar opening. Secondly, by delaying it for 2 weeks, at a minimum, we managed to jump over what could be our busiest, most dangerous week, holiday, July 4th. I'm really quite concerned about the numbers of people in town, and I would very much like to err on the conservative side until we're well past that event.
So Ann, do I hear, so is that a thumbs up for what is being proposed here? Is that a thumbs up, or you want to take it back and?
Tory's the official vote.
Okay, got it. Thank you. Right. Thank you. All right. And then Billy, I saw something.
Yeah, I guess a question for Kara. Do we know how many establishments would be directly affected by this, in that how many will not be able, how many bars would not be able, are not open and won't be able to open with having the limitation?
And John, I think someone just shared with me recently that there aren't actually a lot of, Kara, do you know? Sorry, I don't know the number off the top of my head.
I don't know the number, but we've started a list, and I can pull it up while you guys continue to talk. But I think just one thing to note right now too about this that makes it really difficult with the state guidance is that you you are incentivized to open up under a restaurant because you can open up at 50% capacity. So anything that we would typically think about as a bar is probably already open as a restaurant if they can. And so that's why that number is really low, because the bar is limited to 25% versus restaurant is at 50% capacity.
Other comments? I'm looking here. I'm looking. I don't. Tom.
My concern at this time is the importation of cases over the 4th of July weekend from the states with an upswing that are neighbors, such as Utah, Arizona, and Texas. That's my real concern at this point, because, for instance, New York, New Jersey, and Connecticut have selected 8 states from which those importations cannot come, and those 3 states are among them. So I'm very concerned about those neighbor states. I still get emails from the Texas Medical Association where they have had a huge upswing of cases, and now, just as of this morning, Governor Abbott there has closed off elective surgery, so they will have beds open for that upswing of cases.
Right. Thanks for reminding us of the seriousness of what we're talking about here. I'm wondering if there's some way we can frame this when we get to stick back to the original social distancing and masks, which really are the basis of this. When we start talking about percentages here or there, where it seems like it's so difficult to enforce, it's difficult for people to understand it. But if they know they have to be socially distanced and they know they have to have a mask, we could be making the most difference right there. Kara says there are 15 bars at question with this. I'm just wondering if we might reinforce the orders we have regarding social distancing and masks more vocally, more forcefully if we can, and not try too hard to figure out what 25% is in one bar versus another, because as Tori mentioned, if they're all clustered up against the bar, it makes no difference. So it's more of, let's get back to common sense would be my suggestion. I see Ann has her hand up.
Thanks, Craig. Has there been discussion at all about having a curfew? As I think about it, the dinner hour extends till perhaps 10 o'clock. After that, it's much more socializing, much more social interaction, and younger crowd. Anyway, if we considered some type of curfew, whether midnight or so, I'm not sure that that may be a more enforceable, a more straightforward attempt to reduce the non-compliance.
Thanks, Ann. I'd love to hear from those who haven't raised, didn't say thumbs up on this last, just to hear what their alternate suggestion would be. Is that a thumbs up now from you, Tori?
Yeah,
Okay.
that's
Well, you said yes. Okay. Anyone else want to weigh in on a way we might approach this differently, or are we going to give the nod that public health should move forward with what's proposed? And please correct me if I'm wrong and with my interpretation of what I'm seeing, because I'm just moving around the screen here.
So our proposal is that we take a pause, just to make sure that that's clear, that we do these changes tomorrow, and then we take a pause before we make any other changes to the public health order.
I think that sounds good for me. Kim?
Just quick comment, if you move forward with this pause on opening bars, I think it's going to be essential to message and get this message out, because there's going to be enormous pressure from the state, which has gone to 25% in bars, and then people coming here and being confused. So I don't know how that messaging is going to be done, but it needs to be done comprehensively.
Excellent point. It's a very good point. The level of confusion is still high, and it's high because we have such a changing environment here. And I know we're all trying to be nimble, but you're right. You're right. If it's opening up everywhere else and not here, we may as well put up a sign up at the edge of town. You know, it's like we're a dry county, folks, after 10 p.m. or for whatever percentage. So it makes me nervous that we haven't got this entirely worked out yet. If you wouldn't mind again, Karen, maybe put the screen up again, and let's articulate the way forward, and I'll get one final check-in, and we'll move on. Thanks, Lindsay.
Sure, yeah. So the proposal, or the current state order, says that bars may operate with lesser than 25% of posted occupancy or 50 patrons, whichever is less. And the capacity is determined by that social distancing calculator that they've recently put out. So so our choice is, right now, we could go ahead and align with the state tomorrow. We could look at pushing this out until the 10th or the 24th. So those are really the choices. And I know we didn't say we were necessarily making decisions today, but if the group feels like we need to if we want to go ahead and do this, we would want to write it into the order for tomorrow. I don't want to do another order next week. So, and again, our recommendation is to wait a little bit.
Tori?
Yeah, thank you. Quick question. Have we had any outreach or input from bars and restaurants about how what their thoughts are on this, mostly in regards to safely operating or opening at 25%? Is there some background information from that sector?
Yeah, Kara, do you want to weigh in on just the conversation and I think what you just shared as far as when we could have the sector guidance created by?
Yeah, part of even from the employee and consumer protection is we have not been able to have that outreach. I know Jeanette from the city and Bob are just starting to do that outreach, but that's why we didn't feel we'd be prepared for guidance tomorrow. We do feel like we can start and have those that outreach done next week and start to be working with them.
Got it. Okay. I'm going to try and get back to where I can see everybody again. I think we had thumbs up from a majority of the members of our board that we go with the recommendation of our staff, and I've seen heads nodding. I'm comfortable with that. It's hard to do this when you have holidays approaching and the pressure, but I think this is the important decision we have to make, and I'm comfortable with it. Karen, do you need more from us? Do you want to see we don't need a formal vote, but you need to know we've got your back on this.
Yep.
And is that what else do you require?
Quick question, if I could, Greg.
Sure.
There's two items here. We're talking about bars. We're talking about establishments that are delineated as bars opening at 25%. But what about restaurants that have bar areas and bar seating? Are we talking about allowance for serving food and drinks at bar seating with social distancing in place, or no?
That's a Kara question. I think she said that if they can, they'll operate as a restaurant in order to get to 50%. Is that correct?
That's correct.
Right. Okay.
So a restaurant that has bar seating can open at 50%.
Within the current guidelines right now, there is no service at a bar that's preparing drinks. And if the bar is not preparing drinks, it can be used as seating, just like a table, with the social distancing. So that's what's happening in restaurants, correct, Karen? And so basically what I think there's another discussion because there is some compliance confusion around that, as to whether there should be any seating at bars. But right now, what's being proposed is to wait to align with the state on bars basically reopening, and to stick with the restaurant guidelines as they stand today. I think there will be a separate question about the bar seating within the restaurant context.
And I did just clarify while John was talking to answer that question. The guidance for the state that is bars of 25% seating applies to any bar service within a restaurant, as John said. So any restaurant that is open under the restaurant guidance would not be allowed to be seating at the bar unless they're adhering to the restaurant guidance, not as typical bar service.
Okay. I apologize for my confusion. It's a complicated issue to understand just how this is going to go forward. I want to make sure, checking in again, I am comfortable once again with the recommendations you're making. And I think we should go forward with that. Personally, that's my thumbs up. I saw a thumbs up from several other members. I think we have a majority. I think we should probably just do the high sign again, only because I want to make sure somebody's going to ask for the number and the count, if you don't mind. So we've got thumbs up. I see Billy, Jeannie, Jeannie, Kurt, Tom, Ann, you're an alternate. Thank you. Tori is in. Brent is in. I'm in. Okay. Linda, I think Linda sent us a thumbs up on her chat. If I've missed anybody, I don't think I have here. Okay. Thank you. We have a thumbs up for that. All right. What else do you need to know? What else do you want today?
You had a comment or idea for consideration from Ann a little bit ago that was asking the question if the idea of a curfew has been discussed at the county level.
Comments on the curfew? Questions from anyone? Staff, board, on efficacy, or if somebody can't party in a bar, are they going to go someplace else and do it out of sight? I'm just wondering how does it work?
Can't bars be open till 2 o'clock?
What's that, Tom?
Go ahead, Tom.
Restaurants usually close at 10, but bars stay open till 2 a.m. Do you want to change that to an earlier time?
I think that's Ann's suggestion, is we should
That's
ask
the question. Yeah.
Do we have any data on that? Do we know the efficacy of that in other localities?
Yeah, I think that's the key question. And so we have had that conversation. We've been talking about this a bit, but I feel like it's come up pretty quickly, and we haven't not had the opportunity to really explore what that would mean. John Ely is on the call, and John Peacock if you want to weigh in. We've just started that though, and I would request that we are given some time to think through what that means. I know the restaurant industry had a little bit of a conversation with Bob about this as well. So we have the gathering of some information and input, but I don't think we're in any position today to make a recommendation on that. But I'll turn to John Ely, John Peacock, and Kara, if you just want to tell the conversation that Bob has had with the restaurant so far, restaurant industry.
I saw a comment from John Peacock, but I wasn't sure if your chat comment, John, is there, you're referring, talking to Billy. Okay, just wanted to make sure I understood what was happening there. Is John Ely still with us here? He is. Comment?
I guess the conversations that Karen is referring to, I'm one of the proponents for a early shutdown. The restaurants start acting like bars. It's difficult in an enforcement scenario to distinguish and to make sure that you have the type of activity that you're anticipating when you allow restaurants to open at 50% and you want bars to be shut down. The only other alternative, if we start to see violations, is going to be to shut the establishment, to issue an order to close whatever restaurant is opening in violation of restaurant operation guidelines. So if we are willing to go forward to close down businesses, then I don't think we need to concern ourselves too much with setting up hours of operation. If that appears to be too drastic of a step, then establishing hours of operation, a last seating, closing the doors type of thing is certainly a logical way to go, in my mind.
Okay, comments on that. I'm having trouble understanding how, John Peacock?
Yeah, so, I think what John Ely is talking about is a curfew would give a little bit more of a bright line, I think, to distinguish between restaurant activity and bar activity for enforcement purposes. I think to Karen's point about maybe needing a little bit more time to sort through this, in talking with other managers, I know concerns were raised around enforcement and what the scope of curfew was. Is it a business sector specific? Is it folks are off the street? There's a number of questions I think that need to be answered, in addition to I think Brent was asking about the evidence of the efficacy, and Greg, I think you're making some comments. So where do the people go if they're not in that restaurant environment? Are they continuing to congregate maybe in a social environment where I think, as Charlie was saying earlier, we've seen a number of our cases. So I think there are some reasons to really consider a curfew. I think there's probably some more analysis that needs to be done around the efficacy, and is it achieving what we want to achieve, and do we even have the capability again of enforcement around that is going to be the third question, in partnership with our municipalities. Kara, that probably leaves out, I know you've had we probably should have started with you and the discussions you've had with the restaurant, but John and I jumped in first. So I wonder if you might comment just a little bit on that.
Yeah, I just want to share, we got great feedback from the restaurant industry on this, and I think it's important to understand is really for all those restaurants that are trying to be that are trying to adhere to all the guidelines, maintaining 6 feet distancing between chairs, really they're asking to extend their seating hours. So by putting a curfew on at 10 o'clock is actually putting an additional strain on an already very strained industry. And so their request is, if you do choose to go to a curfew, don't make it anytime before 11:30, ideally midnight. They would like to do last seatings at 9:30 to try and maintain the best economic model for them, because most of them are really operating at, honestly, closer to 35% by the time you take in the tables and everything. So that was just their feedback of consideration.
So Kara, it sounds as if a recommendation, if we did have a curfew, would be something like 11:30 or 12. And that would just be pushing it up 2 hours. I'm okay with that, but I know that may be a burden for many others. I want to keep this moving, but I think this is important. Should we table this and let it come back to us, or should we make okay, Ann?
Yeah, I was just going to say, I made the suggestion of not thinking that we would make a decision at this meeting about it, but just asking for further discussion. And I think what we've said already is really helpful. I'd love to see it come back as a consideration in a future meeting. Okay,
I think that, thank you. It lets us off a difficult hook, but we've also started an important conversation. Okay, it's already 3:35. What can we do to conclude this and make sure everyone feels as if they've had a chance to say what they had to say here? That's a can of worms I'm opening, I know, but I think it's important. We're not really at round robin yet, are we, Karen? Where do you think you need to spend the rest of our time, if we can give another 15 or 20 minutes?
Yeah, I know we have a media call. We'll have to see if we can have Tracy chat with them. I'll leave it up to you, Greg, as acting chair. I had a section to talk about with Protect Our Neighbor, which is, again, the next phase of the state order, what we know and what we don't know. There is still a lot to know. So this could easily be pushed off to another meeting. And I can share with you the PowerPoint so you can see what we know and what we don't know right now, but there's plenty we don't know. So I don't know the value, but I want the board to be aware of that and to be starting the conversations now so that the community is not surprised about how that order is going to go forth.
Great. I think that's a great suggestion. If you'll send us the Protect Our Neighbor, it's the state program, and everyone in the community can review that before our next meeting as well as our board. So let's table that and move forward. The next thing on our list is round robin. I think we've all had a pretty robust conversation here, but if someone has something that needs to come forward, this would be a good time. I know in the interest of time, we're going to be rushed, but I want to, if an idea needs to be thrown out, this would be a good time to do it. Please raise your hand or bark at me if I don't see you on my screen, and we'll try to get through. Just want to make sure everyone, nobody walks away frustrated that they didn't have a chance to make a point if there's one that you need to make. And I'll give you 3 more or 5. Okay, Bill, thanks.
Yeah, I'd just like to go back to the notion of providing restaurants and hotels with masks. Do you think that would be a helpful step, and is it something we can do?
Karen, could you answer that?
Yeah, we have actually talked about, I think I've mentioned these like safety kits in the past, and that seems like a logical place for us to be going as far as a kit that would include a mask and hand sanitizer and information about testing and the 5 commitments. And if we can put together these packets, and John, we talked about this week. I'm not sure if this could be a partnership with the city. It feels like a good partnership. It's a branding opportunity, I definitely think, or a partnership with the town of Snowmass, that we could just get these kits going and really start to distribute them, most particularly to visitors, but anyone who might need them, even folks that are congregating to protest a very just thing of systemic racism in our community.
So that's going to be a budget question, Greg. That's going to have to come back to the board. I don't think we have an estimate right now on what that would cost, but it's certainly something we can look at. And I just note a lot of the restaurants and businesses around town are providing masks. I know, embarrassingly, of all people, I've shown up a couple times and I don't I don't have my mask after a bike ride or such. And Bill, even up in Snowmass, I know a couple of the establishments I've been in were able to provide masks. I think that's happening also in Aspen. And I think we also need to encourage our community to step up. But yeah, it's something we can look at. I do think there's going to be cost and staff time component related.
Okay, if you could come up with a budget item and maybe a way that we could partner with these businesses who are doing it already, support them and what they're doing, and maybe expand that. If there was a way we could support that, I think that's a great idea. And I think we also have people in the community who might actually contribute toward making that happen as well. So why don't we put that forward for our next opportunity and get an idea of what it's going to cost. But Bill, I think that's a great suggestion. And certainly if we're going to be demanding masks, we can help make them available. I think that's a good suggestion. Let's move forward on that. Thumbs up from 3 of us, I see at least on my screen. Brent, thank you. Tori, thank you. Okay, so thanks for that. Any other business that we missed? Suggestions that we wanted to? I just wanted to say that once again, thanking Jeannie for her letter to the editor. Anyone else wants to craft one, I'm sure talking points could be made available to you to help you. Super important that our Board of Health represents in support of our health department and of safety and health here. So I love it to see a letter, and I'll sign any letter or join in with anyone on an op-ed. If you're inclined, please get a hold of me and we can make that happen. Maybe it's from all of us, but I think this is a good time to do it and to support the hard work our Board of Health and our Public Health Department has been doing all these months now. And this is the time to be supporting them. As Karen and I have noticed in the national media, we see many stories about public health departments that are really getting criticized or in disarray or in, has resignations and firings because this has been such a contentious and difficult time for them. And we're lucky enough to have some very solid leadership and guidance through this, even when we didn't know where in the fog we were. So I want to say thank you, and anything we can do to support our public health department going forward here will only make us all stronger. That's my suggestion. Anything else here? I'll, if we have nothing else, I could ask for a motion to adjourn unless.
Brent's hand is up.
Well, my only, just a quick one. Oh, yeah. First off, I love that idea. I love Aspen Mask. I think that's a huge opportunity that would be terrific. And the other thing is the, well, I forgot it now, but anyway, the I love Aspen Mask, I thought was just I know what I was going to say. Yeah, Greg, to your point of individually writing a letter, do you think it would be worthwhile to have everybody on the board sign off on a letter we all agree to, see if we can't get the local newspapers to publish, a half page in this thing, and to get people's attention? Because I know, and I read a lot, yet that statistic about whatever it was, 360 or 70 epidemiologists talking about the horizon is a year off, year and a half off, and what they would be comfortable with, that got my attention. So we don't know what will get people's attention, but maybe that's what we need to do. One half a page or something. It's the thought. Anyway.
Let's work on that. I see Ann nodding her head. Jeannie says she's happy to help us craft a letter. So I think, and I think Tori could probably, Bill and Tori and Marky would probably all sign on to this with me and the rest of us. So, and I'd like to have Kim and Charlie in there as well. I think it's a united front, very important. Any other business, or I think I had a motion already to adjourn from Tom. And if I hear a second, we can move on.
I'll second.
Okay, I've got a second from Bill. No further discussion. I'm going to look for the last chance hand waves. Nothing else.
I'll take it.
All in favor?
I'll take it.
Oh.
I'll take one last chance.
Okay.
I think it's important that the messaging that comes out of this meeting is that while we are both looking at the opportunities for more openings, that we're also taking more precautions, and we are doing even more heightened awareness of the 5 commitments to containment So these go hand in hand. While we may talk about opening up a little bit more, we are also talking about a lot of measures where we want to see compliance, enforcement, and really that collaboration in our community. And that's very important moving forward, I think. Thank you.
Great. Thank you, Tori. All in favor of an adjournment? Aye. Okay. Thank you all, and we'll see you next time. Karen, good job. Thank you for pinch hitting there at the beginning. Well done. I didn't need to be here for that, and I'm
The next
glad I was.
meeting is next week.
Yeah, do we anticipate a meeting next week?
You know, we got off our cycle. Can I circle back to Marky on that and get your feedback? And yeah,
We'll circle back and get a hold of everyone. Great. Thanks. Have a good weekend.
Yeah,
Thank you,
thanks.
Greg and Karen. Thank you.
Thank you. Bye-bye.
Thank you, Karen.